I'll review these again real quickly. I know you all heard me, but just so you know, these are the new conditions for the use of 99509 only. One code is required by Qualitrack. You've been using 99509. Please continue to do that and include the total average daily cost. And then the total hours and minutes do not need to be entered. The frequency does not need to be entered, but please complete the pre-prior approval PAR, the PPA in the bridge, and Telligen will view it in the bridge, except for the SLS. We're asking that you continue to submit the PAR, a snip of the PAR with the SLS exceptions review. For CES, CHCBS, and SLS, continue using the codes that you've been using. And just a note for the CMs, make sure the PAR is entered but not finalized before submitting. Okay, now we're back on track. Thank you, Amanda, for moving me along. All right, I'm going to take a pause here and see if there are questions because I know this is new news for everybody. So I'll stop here. If our chat monitors have seen any questions, please let us know. And if anyone has a question, you can raise your hand and we will take your questions. Okay.
We do have a question in the chat, Pam.
Okay.
From Cindy. So we don't enter the T2025 code anymore.
That's correct. That was a code that had been requested for CDOS in the past. You don't have to do that anymore. Nothing will happen if you do put it in. It won't affect anything. So just so you know, nothing negative will happen, but you really only need to do the 99509.
Beautiful. And this same question duplicated here. It sounds like just clarification for which procedure code to use for CHCBS or CHCBS IHSS.
For if it involves any HMA, you can just use the 99509. If you're submitting CHCBS separately, I believe, and I apologize, I don't have that code in front of me, but I think you're right. It was H2014, if I'm remembering correctly. Bethany put that in. So I will, while we're talking about other things, I'll grab those other code recommendations. They're all in the provider manual. So if you need the provider manual, that has all the recommended codes there. You can always confirm there. Okay, I hope that answered your question, and I will chat in the other recommended codes as we go along. Any other questions? Does anybody want to, on the phone, want to come off mute and ask a question? Okay.
I have a question.
Mm-hmm.
And it was in the chat. We were told specifically, starting with the CC made, to not do the PAR for the PPA and bridge until we get Telligen review. That's something that's been on all the job aids since CCM has been created. And you're telling us that is no longer the case, that we can go in and create the PPA before the Telligen review. And will that mess up any of the communication from CCM to bridge? Because it seems like every time I do that, it will not talk to each other correctly. So I'm just double confirming that that is what we need to be doing.
I don't know, Amanda or Karina, can you speak to the CCM job aids? Do you know
Can't
about
speak to
that?
them directly. I'm not part, I don't assist with, creating those job aids, but that's something I could definitely take back to that team if that's what's being communicated. Because yes, if we need that OCC cost, it's a little tricky to do without entering those services onto the PAR initially. So thank you for letting us know. Happy to take that back, and we'll give an update as soon as possible.
Okay, and that was Savannah, is that correct? Who was speaking?
No, this is Brett Hughes from Rocky Mountain.
Okay, Brett, you're in with Savannah?
Yeah.
Okay, could you just, I'm going to just make a note of that so that I can get back to you via email too if needed. Brett. Okay. All right, thank you. Okay. I don't know about the interactions there that might stop that. To our knowledge, you've been able to create the PAR without finalizing it, and leaving it there until after the review. But we'll definitely get some information out to you on that. For everybody who's here today, we do produce a document for you after every office hours that gets posted to the department's website that has information from past office hour sessions. And then any new information in there is flagged for what we discussed today. So all of this information will go into that document, and we will answer any of the questions that we can't answer right now in that document. And then we can also send it out to the group. Something like this, I think we'll send out through an email blast to make sure that everybody gets it. Okay. Any other questions on the procedure code process? I see some questions on codes coming up. Karina, you put in an answer to a question. Do you want to talk about that?
Oh, sure, Pam. I just was addressing some of the
Thank
comments
you.
regarding
Yeah.
creating the PAR and not submitting the PAR. So we will get clarification on if you can create the PAR prior to receiving Telligen approval. But that is correct. You should not be submitting the PAR, even if the PAR is created, until you receive Telligen approval. I also want to address Nicole's question here, which is the ability to edit the task worksheet in the bridge. Nicole, if you've already finalized that and need to go back and make an edit, you can contact the help desk to assist with that.
Okay.
Pam, we do have a couple more questions. I want to make sure I get this. So just to clarify, HCBS procedure code is H2014, and CHCBS and IHSS should be 99509.
Yes, that will work. As long as there's HMA involved, use 99509.
And then we have another question on CHCBS, is the H214 code or the 98960 web code?
We've not used 98960 web for any of the procedure codes in Qualitrack, and I'm unfamiliar with that code. But if it's just CHCBS, I believe it's H2014, as we've talked about. And we'll double check that and chat that in for all of you before when I'm not talking. So I'll get back to that with you just to make sure you get that today while we're here. Okay. Is there anything else on the procedure codes? I know it seems strange. It's a simpler process than it used to be. We're hoping that it makes it easier for everybody.
Can I ask a quick question?
Sure.
If we do not enter the PAR and we are doing the calculation manually ourselves, will that create an RFI that comes back to us if Telligen staff is not able to see those numbers via bridge and we just are doing them manually?
Yes, we've asked if you can get that PAR in there, started but not finalized or submitted, because it tells us what services you're expecting to get for that person. So if we go to the bridge and don't see that PAR, we will RFI to ask you about it.
Okay, and if we've done them from November 1st through now and getting that clarified, will we be getting RFIs for those if there is not a PAR? Should we go in for those ones in the last 2 weeks and put them in, or?
Well, if they're the only one that would be longer than a few days, then the longest turnaround time is for CHCBS or CES. So the others are all shorter and they're done in 4 days. So if you haven't done that yet, we would ask you for it. If you haven't want to go add it onto the case and we haven't reviewed the case yet, you can always add it. You can always add documentation in QualiTrack as long as we haven't started the review. And then you can add the documentation again, like a picture or a snip of the PAR during the RFI process as well.
Okay, thank you.
Okay, sure.
Pam, this is April. I was just going to say, the case managers do not need to be adding a snip to QualiTrack for the PAR. We just need you to enter it in Bridge, and then we can actually visibly see it in Bridge. So you don't have to be manually taking a screenshot or snipping it into QualiTrack. We can see that on our end.
We do that for all the reviews, except SLS is the only one where we've asked for that to be submitted. Thanks, April, for that. For those of you, I wanted to confirm that H2014 is the code for CHCBS that was requested. These codes were determined early on in this process. So if you can use those requested codes, that would be great. If you use a different code, it's okay. We'll help figure it out between the review type that you select and the code you enter. I think we'll know what you're looking for, but all those codes are in the URUM provider user guide on the department's website. And I'm just confirming that H2014 is the one that some of you have put into the chat to be used for CHCBS, CES, and you can use it for the overlapping IHSS and CHCBS, or you can use 99509 since HMA is involved, which is what the new request is. Okay? Questions? More questions? I think there's some technical questions about some of this, the costs. Are we adding the 12 cents per day for the web benefit with 99509 or just the IHSS cost per day? So when you're putting in 99509 for the Telligen review only, and I'm not talking about anything that you do outside of what's submitted to Telligen, you would put the information into your PAR the way you typically do it and leave it saved and not finalized. And there's a box there that says total average daily cost. So it computes it for you. That's the number we want to see on the 99509 code. Does that answer your question, Francesca? And Linnea asked a similar question.
Yes, thank you.
Okay, good. All right. And did I miss other questions that got chatted in? Okay, if somebody chatted in a question that we haven't addressed, can you come off mute and tell us?
Pam, this is April. I was just noticing that some people are saying that there's an error with Bridge and CCM communicating, and they're getting error codes. I don't know if someone from HCPUF wants to discuss that.
I can address that. Thanks for bringing that up. We are aware that there are issues with the CCM that are being worked through. First and foremost, would recommend to use the CCM desk guides to help with any workarounds or issues. If you are experiencing any other issues outside of that, specifically in the Bridge, would recommend going to the help desk.
Thanks, Karina. Okay. Any other questions about the procedure code process change for now? Okay. All right, if anything else comes up for you, just chat in your question. We'll have time at the end. We'll go on to the next item, which is about OCC. So here's some reminders for OCC. And April or Julie, do you want to review these for us?
Yeah, sure, I can. So for OCC, and we will be talking about this more in detail, I believe in a couple slides moving forward. So we're really just looking at really needing to see the justification of the hours that are being requested. So we're just reminding you that if you have, if it's an IHSS case, or if it's a CDAS case, or if it's just OCC with PCP and homemaker, we really need to see why you're requesting the time that you're requesting. So most of the time we find that information within the CCM in the 100.2 or the IADLs. And then sometimes case managers also upload Word documents that have all of the information that we need. So it's just a reminder to please justify the time that you're requesting. Also, we've been noticing that when some OCC cases have long-term home health, we might catch it in the PAR, we might catch it in some of your wording. A lot of the times we're actually not seeing an upload of the long-term home health PAR and 485. So just a reminder that that's a requirement for us to see, to be able to just check and see if there's any duplication of tasks, just to kind of go through that. So just a reminder to add that in, please. Also, if there's a request for long-term home health CNA and HMA IHSS or PCP, if there's dual tasks being completed, it really helps us out if you spell it out who's doing what when, so that we can determine that there's no duplication of tasks. Again, it's really helpful to see this in the CCM and the 100.2 or IADLs, or in an uploaded document is super helpful to us. But if there's two providers doing the same tasks, or even two providers involved, please let us know who's doing what when. It's very helpful. And then again, just a reminder to specifically with OCC cases, the PAR is required for us to see. So we need you to enter that into the bridge. We will take a look at it on our own, so you do not need to do a PAR snip and send that into Qualitrack. We will take a peek at it, but we do need to see all of the services involved on the PAR, just for us to be able to check for duplication of tasks. So it looks like we have some questions. I'm going to go ahead and pause. I can take a look at them here. I don't know if anybody's reread them. If anybody wants to address, like there's quite a few.
I can tell you, Derek asked, is there a reason if a case is just being submitted for HMA, why are the other services being looked at? Mostly when submitting an extension and a CM makes a change, say homemaker or PCP, and it has nothing to do with the HMA request.
Yeah, so the PAR isn't as big of a deal for non-OCC cases. Obviously, you still have to enter it, but for Telligen purposes, not so much. We are looking at duplication with PCP and homemaker with the HMA, but that should be on your task worksheet. So we should be catching it there.
I want
Okay.
to call this question out too. It seems like a common theme regarding long-term home health PARs and where to submit it. So I see. So you want us to upload the current long-term home health PAR into the document section, and as well as do we submit last year's long-term home health PAR, because oftentimes we do not have a new long-term home health PAR for the upcoming year when we're completing a CSR.
Yeah, and that's typical. We do see that quite a bit, just because we know that the long-term home health company doesn't work as far in advance as you guys do. So if that is the case, you should have an updated PAR. If you don't have an updated PAR, you can submit the old PAR. We just need to see some kind of documentation that you've checked with the long-term home health company, and that all of those services are going to remain the same for the upcoming year. As long as we see that, we're able to use the prior year's home health PAR and 485.
Derek had a follow-up to his question. The comment was that Telligen is denying or RFIing if you make a change to PCP or homemaker, even though they're submitting for HMA approval. And Derek, what you're talking about is an extension or an express review. So I want to make sure everybody understands that an express review can be done by extending the previous review for another year. It's available for 1 year after doing a full, complete review. And although thanks, Derek, it appears that it's not related. Telligen's charge has been to look and make sure that there aren't any significant changes in any parts of the person's services, not just HMA, when there's an express review. So we do look at the PCP and homemaker services as well, just to see that there weren't any significant changes. That's the guidance we've received. And that is what the department set out as for the person to be able to qualify for that express review. And Derek, you're correct in this. For express reviews, we don't do RFIs. We will look at the documentation. If there's something missing or something needed, we will go ahead and deny the case and ask the case manager to do a reconsideration or a first level appeal in Qualitrack. So it kind of changes the process and we hope makes it faster so that instead of going through an RFI and a potential denial, this was what was set up as the process for this during the implementation of the express reviews. So it allows for the case to be denied and the chance for the case manager to provide any documentation that's missing or update anything that was missed, maybe a checkbox or signature or something like that on the express review. Okay, any follow-up on that or anything else on the OCC reminders that April just went through? Did we miss any questions in the chat? I think we caught them all. Okay, we'll go on. Thank you, April. The next section is on supported living services exceptions, and Julie and Karina, would you like to talk about these? Julie, do you want to introduce them?
Sure. There's just a few things with supported living. The first one is obviously we have a new form that has been updated to hopefully make the questions more clear, to help cut back on RFIs so that we can get these reviews done more timely. The form is posted on the HCPF website, which is listed here on the slide. And there's also a direct link to that form. And two things just to keep in mind, the authorizations are for no more than a year, and that the request must be submitted prior to the request start date. So we can't backdate. Karina, did you have anything else to add?
Thanks, Julie. I did have one more thing that I thought to add. Sometimes there are situations where a member receives an enrollment to the DD waiver and the PAR is prorated when you shorten that PAR. And so sometimes the current dollar amount of the utilized services is higher than that prorated SPAL. This is not an SLS exception. You can email the OCC inbox directly for those situations. The SLS exception website has specific guidance on who qualifies for an SLS exception, what that would be, but just another reminder, and we're happy to answer any questions on this as well.
Thank you, Karina. I put the link that appears on this page in the chat. That'll take you directly to the new SLS application form. And the other information Karina was talking about is on the department's website here, and we can you can get more information on SLS from there. Okay. Any questions about SLS? Thank you, Karina. No questions. Did I miss any coming in while I was clicking? Okay. All right, I'll take a quick second. If anybody's on a phone and you can't chat in any questions, come on off mute and ask your question. Okay. All right, we'll go on. Thanks, everybody. We wanted to have an opportunity for the department to show you a checklist that they created to help case managers in the flow of working with cases and working with Telligen. So I'm going to stop sharing. I'm going to turn this over to Karina and Amanda, and they're going to share their checklist with you.
Hi, everyone. I'm going to get this checklist pulled up. So the department has created a checklist for URUM to help walk you through the process. It is an optional checklist, and really, if URUM isn't something you do a lot, if you're new and you're just learning URUM, this is kind of a resource that we intended to help make the process easier for you. It's printable and fillable, and I'm going to go through it. I'm just going to do a quick example of how maybe you could use this form. So your first step is you'll open Qualitrack. Again, if you're using this as a fillable, you'll be able to click on these links. The links will be able to take you to the direct resource that it's referring for additional information if you have questions. You'll identify and select the appropriate type and timeline. So we'll go over a little bit more of what that is. You'll enter the required documentation, and of course that 99509 code, just that code. And ultimately you want to result in submitting a review through Telligen. So you could fill out the member information. This might be helpful if you're working on more than one review simultaneously. And so we'll do an example. You're working with Joe. You just had a CSR with Joe. He's OCC and just added IHSS, so he'll be doing a new review, which would be a standard review. Again, if you have questions on review types, there is a link at the top of this form, and there is more information at the bottom of this form as well. Timeline for review, we're going to select perspective, documentation. Yep, going to need the long-term care screen. It's not initial because it's CSR. And then we're IHSS, so we want to make sure to include that plan calculator, plan of care. Exercise plan isn't applicable in this situation. Again, these don't apply because we're OCC IHSS. Additional information required if applicable. You know what? Joe does have remote support, so we're going to include that service plan. So that's what this form is. This form is really just a high-level overview with resources for case managers to use. Again, more information on the difference between a standard, rapid, and express review. There's timelines included here, what types of outcomes, including turnaround time, a response from case managers if there is an RFI. So this document, I'm going to stop sharing. This document, again, optional, is available for case managers. It currently lives on our URUM website. I will post the website link as well as the direct link to this form. But while I'm doing that, any questions we can answer?
Karina, it looks like we have some discussion about what the rate for OCC is now, and just so we can share the new rate as of 11/1.
Perfect. Thank you so much. Yes, correct. It's greater than $329.99 a day. That did just recently go up. Thanks for the link to the checklist, Pam. How do you all feel about this? Do you feel like it would be a helpful resource for case managers, potentially as a training tool?
Good. We're seeing, yes, great resource for new case managers. Awesome.
Perfect. Thanks for the feedback, everyone. And as you start to use it, if you have additional feedback, please feel free to reach out to us and we can update accordingly.
Okay. If there are no more questions, we'll pause for a second for questions. Okay. Very good. All right. I'm going to share my screen again. And we are going to, here we go. There we go. You all can see that, I hope. Okay, we'll go on to our next topic here, which will be, again, some additional information and tips. And you probably have heard some of this today or other days in our office hour sessions or through our communications in the support center and on our reviews. But these are just doing basic submissions in Qualitrack as a follow-up to the checklist. Here's just some information for you on this. So Julie and April, do you want to review these?
Yeah, this is April. Hi, everybody again. So the first bullet point is CCM documentation needs to be complete and updated, including individuals' needs, care being given, how often, how long, and just a reminder to please update your IADLs and your ADLs in the 100.2. If there's any questions on this, it'd be a great time for anybody to chime in. We have been seeing some discrepancies with the CCM not matching what is being requested on the calculator. I just wanted to point out that even if we do get the information from an agency that might have the supporting documentation for what makes something skilled or how often something is being provided, we cannot accept that alone. We would also need some form of documentation from you guys as case managers to help us understand the need for the member, what makes the task skilled, if it's an unskilled task, why that task is needed, how often it's being provided. We have been noticing that it looks like the 100.2 and IADLs are being copied over from the previous year. So we're not seeing a ton of updated information. So I just wanted to remind everybody that that's really, really helpful. And we'll get to it in another slide, but it's really going to reduce your RFIs if we get that information in the CCM. You can also, if you're not able to update the CCM for whatever reason, you can provide us a Word documentation or any form of documentation in Qualitrack that provides the same amount of information. Again, just reminding you to complete that PAR and bridge. And then I did see somebody in chat ask what the required documentation is for cases. So here's just a little reminder of what we're looking for. For CDAS, all we need is just the CDAS worksheet. That's it, unless the person has exercise. Then we also need a script or order from a required entity, a doctor. We just recently switched it that it can be a PT as well. But we do need that order if CDAS has exercise. And we do need to see the frequency on that order matching what you're requesting on your CDAS task worksheet. For IHSS, the required documentations are the care plan calculator from you guys, as well as the agency care plan. That agency care plan has to have a current date on it, and it also has to have the agency name on it as well. And then again, for OCC cases, we're really just looking for if there's a long-term home health PAR or 485. We do need to have those uploaded. We can pull the PAR from Bridge. So those are the main required pieces. Anything supporting you have for those things, any doctor's orders, any other types of information are always helpful. You can always upload those as well. So as far as submitting a request in Qualitrack, you're going to select the appropriate review type for what you're requesting. So just a reminder that you can use overlapping review type requests. So if somebody has IHSS and OCC, you just have to submit one request. Same thing for CHCBS and IHSS, only one request needs to be submitted. So keep that in mind when you have that drop down to find the correct review type that you're looking for. And then the last bullet point here is use your NPI, your CMA registered with using your Qualitrack when you're submitting, when you're selecting your treating and ordering. We don't need to see the IHSS agency there. We don't need to see a doctor there. We only need to see your case manager agency with your MPAI number. That's in both the treating and the ordering provider. in the Qualitrack area. So I'll stop there. Looks like we have some questions.
Yeah, I'm going to add a quick comment to what you said, April, here on this last point. If you're ever not sure of your NPI number, look just below the providers in the visibility panel. It will have your name or whoever submitted that review from your organization. And right next to that, right below that, depending on how wide your screen is the number that's associated with your agency. For some of the agencies, they originally registered with a system generated number, and they're still using that number. Those numbers start with 99999, like 6 or 7 nines. But you can always tell the one that was registered with us to use Qualitrack because it's right under your name. Okay? That's one way to find it. All right. And questions?
Pam, I had one thing to add also.
Okay.
When you are attaching additional documentation, particularly if you're doing like a Word document, giving us more information, just make sure that the client's name is on it so that we know that it actually goes to that person. And it's very helpful if it's dated, so we know when the information was collected.
Thanks, Julie. All right. It looks like Francesca was having a challenge with the PAR before getting Telligen approval. So Francesca will definitely make a note of on that and work with the department to follow up on any issues that you're having and how to get assistance with that. And the last question, I'll go from the bottom to the top if I can. Who needs to write up the IHSS exercise script?
Does someone from HICPUF want to answer that one?
You're muted, Amanda.
I do apologize. My mute button wasn't allowing me to unmute. Thank you so much for that question. So I just exercise script. It just needs to be documented that it's validated by a physician. It could be PT, OT. I'm going to pull the regulation up specifically as well. Just give me just a minute for that. You have it handy as well.
And then as you're doing that, this is April. I was just going to answer one of the other questions. I did see someone say about Erica. You said that the CDAS exercise frequency must match exactly. What if the member requests 30 minutes a day, but the order has 45 minutes? It's a really good question. If that's the case, we always will take it. If the amount that you're requesting is under what is listed on the order, we always go with it. But if the opposite is true, then we will not. So if you're requesting 45 and the order has 30, then we're going to RFI.
And I want to add one more thing on about this question that was asked about the NPI numbers and tell you why we're using the NPI numbers. When you use the NPI number that your organization registered with, it allows anybody else in your organization to see that case. If you pick an NPI number, and a lot of the agencies have multiple NPIs, so they have NPIs for different types of businesses usually, or business lines within the entity. If you use one of the other NPIs, the rest of the users in your company won't have visibility to that case. So if that happens, and it does happen sometimes, people forget which NPI to use, you can put a ticket into the support center and we can go in and fix the NPI number so that the users within the company can all see the cases for members that are assigned to you. Okay, that's why we're asking you to use that same NPI number. It just provides that visibility to everybody in your company instead of just to the one person that entered that case. It helps with having to share, the completion of the cases if needed, or someone's out for a while and they're taking over a case, that sort of thing. Okay, couple more questions coming in.
Yeah, I did want to call out. I do apologize. I was thinking of upcoming CFC for exercise, so I do apologize. For IHSS, you do not need a prescribed health exercise plan like you do for CDAS. So no, you do not need it. to be prescribed by a doctor.
That's correct. We do need a plan if you're including exercise time. It can be from the individual, from an agency, from a PT, from the caregiver, just to understand what's being done and what hands-on assistance the caregiver is providing. Okay, any other questions on this screen, on the 101s here? Okay. We have another screen of suggestions for you and tips for you. So we'll go over these and then we'll take questions on those. April, do you want to continue?
Yep.
Okay.
So in Qualitrack, you'll see an area for diagnoses. Only one diagnosis is required here. It is nice and helpful. Sometimes we see a lot of diagnoses from you guys, which is helpful to us because it really just gives us a good indication of a full picture of what's going on with the member. However, it is not required. So you absolutely do not have to do that. Just one is required in order for the Qualitrack review to be processed. Again, for HMA, OCC reviews, or even HMA reviews, CDAS reviews, the only procedure code we need right now is 99509 with that total cost per day. And then, like we said earlier, all of the other ones, like the kids waivers, all the other, that's all H2014. All right, and again, you're adding the total cost per day from your PAR. Should just calculate for you after you've already created your PAR and bridge. That's the only amount we need there. If the case is OCC, sometimes we have seen that an OCC case has long-term home health, but it might not be available in the bridge printout for some reason. So if you are filling out that 99509 and you haven't calculated the long-term home health cost in with your HCBS services, we do need to see both together. So please add that to 99509 if it's an OCC, or even if the person is not OCC and they have long-term home health, please add that in as well. Any notes that we may need, please add to documentation Qualitrack. Also, it's helpful, there's a comment area in Qualitrack. If you feel like there's anything we need to know, it's a great area to put, hey, this is a revision, or hey, sorry, this is late, you know, or if you need us to correct dates or anything. Well, I should say, if you need us to correct dates, the proper way to do that is to submit a ticket. And Pam put that in originally, I think at the very top of the chat. I don't know if you want to add that in again, Pam.
Yep.
How to contact our help desk to change any dates, but use the comment area for anything you want us to know. It's helpful. Uploading documentation. So again, we kind of went over everything that was required. Sometimes the cases can get pretty complicated when there's IHSS, when there's long-term home health, when there's PDN, private duty nursing. So it is helpful to see schedules so that we can kind of determine who's coming in when and what the hours are. It's also helpful if a person has a lot of adult day program and there is a lot of care involved as well. It's very helpful to see the schedule of the ADC so that we can kind of get wrap our minds around how a person can be getting so much care and be going to adult daycare at the same time. Just really helpful to get any more information that you think we might need. And then at the very end of Qualitrack, you're submitting, I believe I'm gonna let Pam, you take this part. It's called an attestation, but I believe it's just your contact
Right.
information. Yeah.
Yeah, just once in a while we get a question about this and why can't I move forward with getting the review submitted. There is one required attestation statement in Qualitrack. It's for every review, for every contract, everywhere. And there's a small list of items that says, I attest that I've uploaded the needed documents. I'm telling you the truth. Items within that. Just know that that's a standard operating procedure. You just type in your username, and that's the trick. It's not not your full name. It's not your first and last name. It's your username. So that's what goes in that little box at the bottom, and you just submit it from there. That's just a reminder that it's your username.
All right. And then again, here is the link to our Colorado support, our help desk. There's a phone number as well as an email. Anytime you have questions regarding a case, if you need technical support, these are the two things to contact right here. You can call the phone number and or submit a ticket via email. And then you should be seeing emails come to you when we've generated an RFI, a request for information. An email should be coming to you with that information. And you would also get the same thing if we did an outcome. So if a case was approved or denied, you should be seeing those in your inbox. All right, we'll pause for questions. Is there anything in the chat?
I see one that I think maybe we didn't answer. It's up a little ways. April, it says, if nothing has changed and the HMA was approved last year, what are we supposed to update?
I'm assuming you're talking about the in CCM, the 100.2 and the IADLs. Is that correct?
The ADLs, IADLs.
Okay, so if nothing has changed, you don't need to update anything. The comment I made earlier was really in relation to the CCM information not matching up what's being requested. So say, for example, someone is requesting 210 minutes a week for bathing, for skilled bathing. But then when we go to the bathing comment, it says member is able to bathe independently. So that's what I was referring to updating your information in CCM. If your documentation matches what you're requesting and nothing has changed from the previous year, I don't see why you wouldn't be able to just copy it over from the previous year. Hope that answers your question. Any other questions?
I think there are a couple things in the chat. A suggestion or request from Amanda. Hey, Amanda. It would be helpful if the question answers from the chat were transferred to a Q&A document and sent out or available on the website. Thanks for that. Yes, we will have the Q&As available on the website. Typically, it's about 10 business days after our actual meeting. Pam, thank you for being so prompt and posting the slides as soon as we're done with the presentation in the chat. And those will also be available on the website again in about 10 business days.
Thanks, Karina. Okay, if there aren't any other burning questions on submissions, we're going to go on to the next topic, which is RFIs and how to avoid them. Okay, Julie and April and Julie, do you want to talk about these? Let me just give this a little caveat here. These are taken from what we see the most in terms of RFIs, what we RFI the most for. So we thought we'd bring them into this conversation and just review them with you and see if there's any questions about these so that we might be able to avoid issuing RFIs for you when you're submitting. So we'll review them and then take your questions.
All right, so the first one here is kind of just repetitive what we've been talking about. Please ensure that your CCM documentation is up to date and also matching what you're requesting. For example, again, we'll talk the bathing example. If you're requesting 210 minutes a week in bathing, we really need to see in your bathing comment why, or we don't need to say exactly that it's 210 minutes, but it needs to make sense to us that that task is taking 30 minutes a day based on what you're documenting. We also need to see if you're requesting the bathing to be HMA, why it's skilled. So I just wanted to shoot a reminder out again regarding the HMA documentation guide. We have been seeing some questions coming through in our tickets, as well as I've seen some things within the cases as well, asking what makes a task skilled. So just a reminder to use that HMA documentation guide. It's very, very helpful. That's what we look at when we're looking at all of these to see whether it's skilled or not. We have it up all the time when we're doing these reviews. So please, you know, take a peek at that. I don't know if we have a link for that, Pam, that we want to put in the chat,
Yeah.
Pam or HickPuff.
I'm trying to
really-
post it, April, but it's not playing nicely with me, so I'll get it for them though.
Okay. Also, just a quick little reminder here too, that we are paying attention to the Medicaid time norms that are on the task worksheet for CDAS as well as the IHSS calculator. So a lot of the tasks on them have a specific time, of how long a task is taking. That's been created a very long time ago through Medicaid on, I don't know what kind of studies were done on why those times were created, but that's the guide that we all use for how long a task is taking. So please keep that in mind if you're asking for time over that norm, to please document why. You know, for some reason, I'm the thing that's popping out in my head is dusting, for example, is 35 minutes a week is the Medicaid norm. Maybe we see that you're requesting 70 minutes a week because that person has allergies and needs dusting to be completed more frequently. So we do need to see that within your documentation as well, preferably in the CCM, but also can be uploaded in any form of documentation from you into Qualitrack. All right. So please include specific information on the individual needs, what care is given, how often, and how long for each time. This really helps us on just keeping in mind that we don't know who this person is. We've never seen this person. We're relying on your documentation to really tell us what's going on and why you're requesting the time that you are. Again, just a reminder that if long-term home health is involved, to please upload that long-term home health PAR and 485. Couple of different things here. What we've been seeing, some case managers title the long-term home health PAR is actually a screenshot of the long-term home health picture from Bridge. So that is not the long-term home health PAR. The long-term home health PAR should be coming directly from the agency. It has the units on it, it has the rates on it, and it says, you know, how often the long-term home health is coming out. So we do need both of those included when you're submitting for anything that has long-term home health. We also have been noticing, I actually don't know whether it's certain agencies or what, but if a long-term home health is being provided and the person has CNA, we have been noticing quite a bit that the 485 just says CNA is assisting with ADLs and IADLs. I'm not sure if that's changed or if that, like I said, if it's specific agencies, but if you see that, please take a peek at that before you submit it, because we do need to have more information. Whether or not you want to go back to the long-term home health agency and ask them for more specific details on what that CNA is doing, or if you already know and you want to put that information in the CCM, or if you want to tell us in a Word document or some form of documentation, we really need to know what that CNA is doing. So again, that we can compare with other services and make sure there's no duplication of tasks. Again, there's a note section in Qualitrack. There's also a comment section in Qualitrack. You can let us know anything that's going on that you feel like we need to know. It's a really good, helpful areas. Again, just another reminder for our CDAS exercise that we do need that order. We have seen that missing. I think a lot of the time what ends up happening is we've been seeing it with CSRs. So you might have included it in your previous review and you're not including it in your CSR. So just a reminder to pull that over and put it in the new review so that we can see it. Also a reminder that this does not need to be a current form. Even if the order is a few years old, we can still accept it as long as it's relevant and matches the frequency that you are requesting and has the signed part from the clinician that we need. And again, actually, I don't know that we've touched on this one. So if a person has OCC and we don't have a calculator, we don't have a task worksheet, sorry, that's CDAS, a calculator telling us what all of the services are. Maybe this person has OCC and just has PCP and homemaker. We really are counting on you to let us know what those people are doing in the home. Say, for example, the PCP is coming out for 40 hours a week, and we take a peek at your CCM, but it's just not adding up. Based on the comments that we're reading, we're going to RFI and we're going to send it back to you and ask you for a detailed task list on not only everything that they're doing, but why they're doing it, how often they're doing it. And a lot of the times, you guys are sending us agency care plans that spell out what that PCP is doing. Those are fantastic. We love seeing them. We just need to take it a step further and make sure that the tasks that are being requested on that agency care plan are also matching what the need is within your documentation in CCM. So again, we can't just take the word for the agency on what's happening. We need to also see it in your documentation as well. I have been seeing the chat popping, so I'm going to pause for questions.
So we have a question about us needing the long-term home health 485 and long-term home health PAR. We've got two people telling us that that stopped on October 14th, 2024, in that the long-term home health agencies are submitting those. So I need to maybe toss this over to the department in terms of our review and our requirements. The case managers are saying they don't get these anymore, and they're being submitted by the agencies. Can you help us out with that?
Sure, I will jump in, take a whack at that. So, I know we had this comment earlier as well, and I had replied to the comment just mentioning to reach out to our home health team at the department. But yes, this was a recent change, and I'm not sure if this is something that was considered. So I am happy to take this back as well to our home health team. So that we can find a resolution quickly for that, because we do need the copy of the PAR.
Thanks, Amanda, for everybody who's wondering about this. Kayla also had a message in, David, and I think one other person. We'll include the information that the department provides to us about any adjustments to the process in our office hours write-up document, and we will send out an email blast when that's available so that you all can access it and make sure that everything's clarified around this. Okay. We have a few more. I don't know if I missed any other messages coming in. Did anybody else see one or have another question about the information April just reviewed for the RFIs? Okay, we have a few more little tips here on RFIs. We're getting close to the end here. So April, are you continuing? Or Julie, I don't know who's picking up this page.
Julie, I think this
I
next
can.
part is SLS and CES.
There's only, like Pam said, a few things left. There's just a reminder to fully complete the applications. That specifically applications are for SLS and CES. Don't leave blanks on them. And that way that can definitely avoid an RFI if we're going to send back and don't have a full explanation of what's going on the client. On the next one, it looks like Pam, I think you already put
Yes.
this in the chat, so you
Yes.
can find that there.
Mm-hmm.
And the last point that we had was when responding to an RFI, make sure that each item is addressed. So if you're going through and we have 3 things on there that we're asking about, don't miss that last one or the middle one. Make sure you're going through and answering each question fully. And submitting an updated calculator or task worksheet if you're changing anything. We need the worksheets to match what you're actually asking for. And add any clarifying information. Again, on that second separate document, You can always upload that, make sure the person's name is on it, so we know that's who that goes to. But using that separate document can be very helpful, especially if you can't get back in to the CCM to add documentation.
Okay. I want to just add on to what Julie said about completing applications so there are no blanks. We're looking for signatures and dates, and we have guidance from the department about what constitutes a signature. It can be an actual physical signature written on the form. It can be a digital signature. It can be a typed signature with a date. Those are the signatures that can be accepted. If you wind up with an RFI from us because a signature is missing, we'll tell you what's missing from it. So the signature actually needs to have a date on it as well for all those forms. So they go together there, some type of signature and a date. Okay. Karina, that guidance came from you. Is there anything else that we need to say about signatures?
Nope, there we go. I think you covered
Okay.
it, Pam.
We got it then. Okay. Thank you.
I
All
did
right.
want to add one more thing about
Yeah,
the
Julie.
signature. You'll have that printed signature or the printed name line and the signature line. If you have that on your form, please make sure that you're filling both spots out on that form.
That also goes for the attestation form for the express reviews. There's a line for the signature from the case manager. So please be sure that's also signed and dated. Okay. All right, we'll take a pause for questions here. Any questions? Anybody on a phone that would like to unmute and ask a question? Anybody? Any chat questions we missed? Or that you just thought of that you'd like to ask now? Okay, Jennifer, could you explain the difference between, oops, you just rolled up, between requesting time under accompaniment, under personal care, and accompaniment under HMA, and can you have time under both specifically for CDOS clients? April, can you take that one?
Yes, sorry, can you reread that question for me one more
Yeah.
time, please?
Could you explain the difference between requesting time under accompaniment in personal care and accompaniment under HMA? And can you have time under both, specifically for CDOS clients?
Yes, that's a really good question, Jennifer. So the difference is accompaniment under HMA needs to have some type of skilled task being completed during the accompaniment. For example, maybe the member is a quad and it needs skilled assistance with transfers and mobility. And then in your accompaniment, you're requesting time when the member is out of the home for those transfers and the mobility. If there is other tasks being performed while that person is out and about, you can still request that under HMA. It's considered in conjunction with. So say, for example, that member is needing skilled assistance with mobility and transfers, and they're also needing help maybe communicating with the doctor and or opening doors and or maybe feeding that isn't skilled. All those types of things can still be requested under the HMA task as long as they're being done in conjunction with the accompaniment. If it's separate and they're not being done at the same time and it's not a skilled task, then yes, you can request that in the PCP task. What we would be looking at is that you're really spelling out what the difference is, so that we're really looking to make sure that the time you requested in each area makes sense and there's no overlap or duplication with those tasks.
Okay. Any follow-up to that?
Yeah, sorry, can I come
Yeah,
off?
go ahead, Jennifer.
I guess that made sense. The only thing that I feel like I'm having a hard time regarding the time, because when I think about accompaniment, I'm like, you're going with somebody to like a doctor's appointment or grocery shopping. Like, what is it specifically you're accompanying them to? Are those kind of some examples, like a doctor's appointment, the park? Like, I guess that's where I'm a little bit confused.
Yeah, accompaniment can be a caregiver going with them anywhere. Not anywhere, doesn't have to be anywhere specific, just as long as they're out and about accompanying them somewhere. All of those would qualify. Yeah.
Okay, and so then the time would be, because then there's time under transfers and mobility, right? And so the time that you're requesting under this specific task would be how long you're there at that specific place with them?
No, not exactly the whole time that you're there. It would just be time for the task. So a lot of the times we'll see maybe that in the transfer task that member
Mhm.
is being transferred 7 times a day in the home, and they'll specify, that that's getting in and out of the bed, that's getting up and down from the toilet for whatever it is. Those are specific to maybe when the member is in the home. And a typical transfer under the Medicaid norms is for 15 minutes. So we'll take that into consideration when we're looking at the time for those transfers. Same thing for accompaniment. We would be looking at, if you are requesting transfers and accompaniment, we would be making sure that those are separate transfers than the ones that you've already requested. And we are just looking for the hands-on task time. We would not be approving time for someone to just be sitting with a member. They would have to be doing some task for that time to be approved.
Okay, so I can separate, because I think for one individual, I put transfer time, mobility support, all under transfer, so then I can kind of remove time from there and then add time under the accompaniment, specifically when they're out in the community, because I added like getting in and out of the car, if he needs to get down for his appointment, like I did all that under transfer/mobility time, but it sounds like I can separate them
Yeah,
based on what's done in
you
the home
can.
and then, okay.
Absolutely. But we would also accept it under transfers as well,
Okay.
as long as there wasn't time under accompaniment, as long as you're really specifying what the time is for and it makes sense, then we would accept it in that area as well.
Got it. Thank you.
Okay, thank you. There was another question. Kim asked about an instructional video, and I'm just writing a response to you, Kim. There was a detailed video that was just removed, and we're working on updating some of the resources. We hadn't planned on doing another video, but I think it would be a good idea to do. So we'll discuss that with the department and maybe make a plan to get that. In the meantime, there are other resources there. We have updates to tip sheets coming. And the most important resource for you is going to be the support center. If you ever need any help with entering cases in Qualitrack, you can call the support center during business hours and the agent can walk you through the steps to submit. So I'm going to post that number once again and finish this message so that everybody else can see it. Okay. Were there other questions that we need to see while I was writing this?
I see a question about accompaniment for walking a service dog. Brooke, I don't know if you wanted to come off mute and ask your question, or if that was your question. Okay, and it looks like the other question while we're waiting for Brooke is what qualifies, kind of got lost in my chat here. I saw something about protective oversight, what qualifies protective oversight. I don't know, Karina, did you want to take that one?
I'm going to actually pass that over to Amanda. That typically is under IHSS. Amanda, do you have any more information on that?
Yeah, definitely. So protective oversight. So in general, it's allowed when your member like requires standby assistance with any of their personal care tasks. So that may be, I'm trying to think of a good example here. Let's say they need to take a shower and they have a fall risk, right? So we may add some time for protective oversight while they are completing that bath. Um, that would be something that is qualified as protective oversight. And just for, I know we were waiting for Brooke regarding the walking a service dog. That is typically not allowed. The accompaniment is specific to having the member with you during the task. So if it's walking their service dog, unfortunately, that would not qualify as something we can authorize. I See a hand up. Ally, is it regarding protective oversight? Go ahead.
Yeah, I just wanted, can you repeat what you just said? Protective oversight is while completing.
Like standby assistance for any like personal care tasks. And it could also be used as to prevent wandering. I'm thinking about cognition and things like that.
So like wandering, so like I've given protective oversight for like behavioral issues for like the one off the top of my head, an autistic client that has limited, you know, cognition and safety boundary issues.
Yep.
So we gave him obviously protective oversight. And are there any other ones that you can think of? Um, I've had people ask for protective oversight for like dementia, but then it gets to a point of at what point is it more safety and you know what I mean? Because at that point, you know, if they have dementia, we can't just sit and watch them 24/7 because when is it companionship and when is it safety related?
Right.
You know what I mean?
Yeah,
So
absolutely. Definitely.
Yeah,
And
I
that
was
is,
just
I
gonna,
mean, yeah, go ahead.
sorry, I was just gonna chime in. What we're really looking for is the intervention. What's the intervention that's being done? Um, you know, why is that time being needed? Like you said, just sitting with the member isn't necessarily an intervention, but say the person does have Alzheimer's and is a wander risk, you know, you're telling us that, you know, 15 times a day they're getting up and they're trying to walk out the door. And the intervention would be stopping them from walking out the door and setting them back down again.
okay.
Also, you know, you mentioned as well, like really what we're looking for is something that's putting the member at risk, like a safety risk to them, and someone is intervening somehow with an intervention that's
Okay.
stopping the member from doing that harm to themselves or someone else.
Okay, so I know like in my personal experience, I've been at 2 counties and there's definitely between counties and between agencies, there is a huge discrepancy in the interpretation of protective oversight. So anything you guys can clarify with a write-up would be super helpful. Um, and then just to double check, but like I just had a client that we did give some protective oversight to because in her case, she does sundown and will wander, but the intervention, they'll do the distraction for about an hour and then she's okay. So if that distraction is occurring for a span of an hour, are we okay to give that block time or do you want that broken up into different times? Because again, I get from one county to another, they want different things. Like I was taught one way and now I'm being told a different way. And it's just super confusing. So
I think
whatever is
it
easiest.
really just depends on your documentation, how we're looking at it.
Okay.
Again, we've never met this
So whatever my
individual.
documentation says, if I give it a block time, it makes sense to do 60 minutes at sundown for that 1 hour intervention.
Right. And keep in mind too
Okay.
that the person in the sundowning period one day could have 2 episodes and tomorrow have 20 episodes in that hour. So, you know, we're
Right.
taking that into consideration too. And we're really just relying on your documentation.
Okay. Thank you so much. That helps.
Thanks, Ellie. I also just wanted to call up. Thank you for that feedback for protective oversight training in general. We're happy to take that back as well. And Jennifer, go ahead.
Yeah, and just kind of piggyback off what we were just discussing. So if an individual is basically getting full hands-on support for personal tasks, can you request time under that protective oversight if they're getting hands-on? So technically you're not just watching them to ensure that, you know, they're getting the task completed, but you're providing that hands-on, which technically you're also right there, stand by.
I think the hands-on and the standby makes more sense in the tasks that they're, the areas that they're requiring assistance in. So for example, falls could go under mobility. I'm trying to think of other examples, but it does make a little bit more sense for the actual hands-on task to be in that specific task. And then protective oversight is more, the way I think about it is that it's keeping that member safe. So, maybe they're having a behavior related to that ADL or that task where there's intervention needed during that task, then I would maybe move that along to the protective oversight piece. Does that make sense?
Yeah, so like if for an individual who's like gets full hands-on support for eating, like he's being fed, right? Like oversight where your standby assistance because he could choke, would that be kind of but no, that's not a personal care.
Well, it would
Right.
be HMA if they're
Right,
if
right,
they're choking risk, yeah, and standbys
right,
needed, that could go under the feeding or the feeding HMA task. So
right.
I would just look at it like if it's a task related to something that's already on your task worksheet and they're
Mhm.
actually just helping with that task specifically, that's where I would put it. If it's a behavior related to their safety, that's when I would kind of move it over to protective oversight.
Got it. Okay. Makes sense. Thank you.
Hi,
And
can I ask
Amanda
my
and
question?
Karina, if I didn't explain that
Yeah.
right, or if there was anything else, please jump in.
Great. It was perfect.
Okay. We're at the top of the hour, so I wanted to just note that for everybody. I posted the slides here, a PDF of the slides that you can download. We'll keep this session open. You'll have a chance to download that now. So I wanted to make sure that if there are any other questions, the Telligen team, and I can't make a commitment for the department team. It depends on their schedule, but we can stay on for a little bit longer and try to help answer questions. If the department team can stay, that's great. I wanted to tell you how much I appreciate your questions and your participation in this session. So thank you all for coming. Just a reminder that we have resources on the department's website. All of this is in the slide deck that I just posted. Also the support center information, and we've been through Q&A that came up through this. I had planned another beautiful slide for that, but we kind of rolled right into it, which works really well. So thank you all. We appreciate it. And we'll stay on here and make sure that if there's remaining questions or anything to talk about, we can try to address it or make sure we understand what you're asking so that the next time we produce something, we can answer that question for everybody. Okay, thank you all for being here. We'll continue with the Q&A. And Mackenzie has her hand up. Do you want to say something, Mackenzie?
Yeah, I just want to clarify. I don't know if it was super clear or not, but like way in the beginning of the meeting, you said that the PAR should be created prior to any submission. So does this include like IHSS, CDOS, anything that's not even over cost containment?
Yeah, our team actually goes in and looks at the PAR for all of our reviews.
Okay.
So ideally you want to get the PAR information in and then submit to Telligen so that we don't RFI to you for any questions that come up.
Okay. And
Okay.
then is this like a new change or has this always been like this and I just never noticed?
Um, we've gone through different phases of how this worked depending on there were various things tried over the course of the last over 3.5 years, including having the case manager snip the PAR and submit it, and then having only some of those submitted to Telligen for our review. And we at one point stopped that because we could get in and view it, and then you wouldn't have to snip it and send it, but they're not always there. So, I would say that the current direction is get the PAR entered but not finalized, and then that allows our team to go in and look at it. Then you don't have to snip it, create it, snip it, send it to us, right? So it's a little bit less burdensome. And that's, always been the goal in the program, is to try and make this as doable as possible for everybody. So that was
Okay.
one of the changes that was made at one point as we moved along through this over the course of the last few years, Mackenzie.
Okay.
Okay,
Perfect. Thank you.
sure, you bet. And
E-
Kim? Oh, sorry, who was going to say something?
Eva has a question as well.
Okay, okay, thanks.
Okay. Hi. Can
Hi,
you guys
Eva,
hear
go
me?
ahead, and then Kim will do yours next.
Okay, thank you. So I was logged in on Brooks on accident, so that was that confusion there. I
Okay,
had a link sent from her and my own
okay,
link.
got it. Okay,
So I'm on my own now, and I was wanted to clarify my question about the dog walking. It's not that she wants someone to walk the dog for her. It's that she wants someone to walk with her so she can walk her dog. Would that go under mobility? Would it go under accompaniment? Would I need to get a script from a doctor for
So you
exercise?
could put that under accompaniment,
Okay.
or mobility. Probably just accompaniment would be the least
Okay.
confusing, and you don't need a prescription for that.
Okay.
But just let us know like what the caregiver is doing for the member during that time.
Great. Thank you so much.
yeah, that's the important part, what Jasmine just touched on. We need to understand what the caregiver is doing to support the person. So not just that it's they're walking the dog, right? What kind of support is the caregiver providing?
Got it.
Okay. And Kim? Thank you, Eva.
Yes,
Thank
so thank you for saying that you're going to make the video. I really appreciate that. And then also I'm a former teacher. I was a tech teacher. And I would just have some suggestions about the video. First of all, I think the video should be full screen. We actually don't need to see the person talking in the video. We need to see the actual information. Because the last video I watched, I was like up, up like with my eyeball on the screen trying to see it. And then
Oh,
also, when they were referring to things, they never cut away to what they were talking about. And as a new case manager, I was so frustrated because I didn't know what they were talking about. So if somebody refers to something, I would suggest that they cut away to that so that we can see what they're referring to. Because I think there's an assumption that all case managers have been doing this for a while, when actually there's been a lot of people that are new and have been hired
right,
and they really need that
right.
extra support.
Yes.
Thank you for listening.
You bet. Thanks, Kim. I appreciate your suggestions. I think the videos that we've produced specifically for entering cases, I don't think you ever see our faces, at least that we've had. With the changes in program, we've needed to update those periodically over time. But I agree with you totally. And I think at least the ones that I've been involved with, we have, I don't think you ever see me. I think you just hear my voice telling you what to do. And I'm showing you literally what's going on in Qualitrack when we do it. So
Oh, yes. One more thing. Thank you.
sure.
Also, I think you should zoom in sometimes, because sometimes we just can't see what
Okay.
you're talking about. But thank you so much. And
Yeah,
thank
you
you for
bet.
changing the process. It's so much better.
Good. Well, thank you. I appreciate the feedback and the suggestions. Thank you for doing that. All right. Is there anyone else, any questions, anything that we missed in the chat that we need to address? We'll give it another 20 seconds in case somebody needs to come off mute. Okay. I'll do my ending comments here. I just want to thank everybody for being here. Thank you for being so thoughtful in your participation, for bringing your questions and concerns and suggestions to us. We greatly appreciate it. We all appreciate that we're all working on this and moving forward together to the benefit of the members. So thank you for what you do, and thanks for being our partners. And same to the department. Thank you. For your collaboration and putting this on. Thanks, everybody. We'll stay here for a couple more minutes in case anything comes up. And we appreciate you all being here, and we'll see you the next time. Our next office hours is in February. We'll be sending this out to you February 13th, 1 p.m. So mark your calendars, and we'll see you in February. Have wonderful holidays and a Happy New Year. See you in February. Thank you all. Thanks all. It looks like there aren't any more questions. Thank you all for being here. Thank you, HICPUF team. We appreciate doing this with you. Thanks to everybody who's here. I'll go ahead and stop the recording and we'll close this down. Thanks all. Have a
Thank you,
good
Pam.
evening. Emily and Kayla and Laura, was there anything else you needed today? Any other questions? There's a few other people on, Nadine, Regina, Rosita, Tommy. Anybody else have questions that you need answered from us? Okay. All right. Thanks everybody for coming. I'll go ahead and end the meeting. Appreciate you all being here.